latest EREPS webinar, the first one we've done for a little while, actually, but we have an intention to do a lot more in the new year. But we're running this one because I think it's a particularly pressing subject, something that we need to deal with, and that we need to give you guys out there some guidance on. And that's sort of the area that we're focusing on today, is actually looking at those people who have suffered COVID-19 and are recovering from COVID-19, and that number is obviously significant and increasing. And how do we actually, as exercise professionals, deal with these groups? How do we prescribe exercise for them? What should we be aware of? This is clearly a very important area, and I'm very aware that lots of people across Europe are looking at this area in different countries, working with the medical sector in many cases to come up with these guidelines. EuropeActive are also looking at developing their own guidance in this area. But I've been talking to a group now for a month or so, or maybe even longer, that CAWS, and the slide is neatly moved on. So the CAWS group, who are, I guess I sort of feel a little bit ahead of the game here, in that they have been looking at this area for some time and have actually developed some training courses around this area, which I think would be extremely useful to EREPS members. They have actually a course that is now approved by EREPS. It's approved under our Lifelong Learning Programme. It's the so-called Rebuild Programme, which is part of this COVID-19 rehabilitative strategy. That's not easy to say. So I'd like to introduce the guys from CAWS, and we have two representatives today. We have Dr. Colin Robertson, and we have Mel Spooner. So maybe Mel first. So Mel is the managing director of CAWS, and I guess in this session we'll be asking a lot of the questions to Colin, and Colin will be giving us the benefit of his quite significant expertise in this area. So managing director, and I guess Colin would be the educational director of CAWS. So I really want to sort of step out of this if I can and listen in with you guys. But I maybe I'll interject at a couple of points just to ask a couple of questions, but we'll see how we go. But I'm going to turn it over to Dr. Colin and Mel, who'll introduce themselves, give a little bit more detail on their backgrounds, and then start telling us a little bit more about this program.
Amazing.
Okay, Mel.
Thank you for the warm welcome, the very kind introduction, and thank you to everybody that I've seen dialing in the last few minutes to take some time out of their afternoon to join us today. Carl, do you want to go first and share your background with the guys?
Yeah, I'll try and keep it brief because we can spend more time talking about things that you're arguably more interested in. But yeah, thanks Mel, and thanks Julian. Yeah, my name's Dr. Colin Robertson, commonly referred to as Dr. Cole, and my background really goes from everything from clinical exercise physiology, working within cancer rehabilitation, COPD, type 2 diabetes, neurology, musculoskeletal, orthopedics, all the way through to helping athletes prepare to take part in the Olympic Games. Train people to climb Everest, row across the ocean, done a lot of environmental work, and my main area of research really boils down to fatigue in its multiple forms. But I spent a lot of time over the past 10 years working specifically with people who've had cancer, and also on projects all across the UK and in fact parts of Europe, looking at the reversibility of type 2 diabetes through exercise modalities and lifestyle behaviour changes, particularly looking at their nutrition. So I spend a lot of my time in research, but I'm still a frontline practitioner as well, embedding practice, embedding what we do directly with the populations that need it. Here in the UK, I'm also a gym operator. We have a gym on the Wirral, which is not far from Liverpool, if people know where that is. And we've run that now, the UTS, for over a decade in partnership with a good colleague of mine who also works in elite sport. But I'll hand over to Mel, who, before she even comments herself, is the glue that keeps the fitness industry together.
Thanks, Carl. I'm not sure that's entirely true. For anybody who's listening and we've not met before, I've been in the fitness space for around 15 years, initially in operations, and then really, I guess, my career kicked in when I did a couple of years working for Technogym. I left Technogym and was fortunate to be part of the startup team for MyZone, where I worked with Dave Wright and the team for a couple of years. Left MyZone to set up the UK, help set up the UK office for TRX. And then after that role, looked after Dynamax Medicine Balls, Viper, PTA Global, and PT on the Net in the UK. So for a period of around 10 years, I guess, I was heavily involved in all things education, programming and integration, and worked with a lot of clubs internationally to help them to build out their PT academies and pull on global experts and global education presenters to deliver on new subjects that, you know, that guys like yourselves were crying out to hear more about. I set up my first business, TP International, up about 6 years ago. We're a project management company in that hat that I wear. And we're best known for helping brands to expand internationally. So if you're a US brand and you want to set up business outside of the US, Europe, Middle East, Asia, etc., then a lot of brands would come to us, and vice versa, UK going to the US. So I guess a little bit like Carl, worn a few hats in terms of our sector as a business owner in education. Last year, Colin and I got together. We'd already known each other. We met, I guess, Cole, about 6 years ago, I think, through Under Armour, didn't we? And,
yeah.
And then we got together last year to start the beginnings of an education company. Our goal with the education company was always to create content, courses and curriculums that met the needs of you guys, based off of feedback that we'd heard over the years that coaches and trainers were telling us that they needed more information on, they wanted more access to help them to perform and progress in their careers. So that was the premise of the business as we set it up last year. Fast forward to March this year, and of course, as we all know, COVID. So Colin and I worked and collaborated with Julian, the team at EuropeActive, UKActive, SimSpa, shared some ideas that Colin and I had around, in fact, how the role of the coach and the role of the gym can be a vital and essential part when it comes to rehabilitating an individual from COVID and long COVID. And in fact, without being too grandiose, rehabilitating us all out of the situation that we find ourselves in. And the way that we can all work together to do that is by providing coaches and trainers with a training course that helps them to understand the implications of COVID on a person, and how that affects their physiology and the programming and activity prescription that you might provide to them. So we had that initial conversation with EuropeActive, UKActive. Is this something that we think the sector needs? We spoke to a core group of coaches and trainers for their feedback. The unanimous decision was that this could be something key that we could provide to our existing clients and other individuals. So Colin and I embarked in early summer, June, July, to create some content to support this. And we went live with that just over a month ago. But the purpose of this session is not for us to just tell you all about the course. We want to provide you some context around what's going on with the pandemic, what the situation is with COVID, the impact it has on an individual, and then where we see the role of the coach fitting in. Anything I missed there, Col?
No, I think you covered everything, Mel.
Nice. Okay, so to kick us off, we've talked a lot as a sector globally about the role that we can play as coaches and trainers in the prevention of the worst kind of symptoms from COVID-19, so far as promoting good health is concerned. But we've talked a lot less about the role we can play in the rehabilitation of someone from COVID-19. So that's where we're going to start from today. A key question that Colin and I get asked very frequently is, when it comes to the volume of people that need rehabilitating from COVID-19, how big is that population? So lots of numbers on the screen, but as you guys will clearly be able to decipher, what we've done is listed all of the countries that our audience is concerned with, and you'll see the total number of COVID cases by country, the total number of current deaths, and then the number of individuals that are still dealing with the wake of the virus. Cole will speak a little bit now just to share with you guys how that rate has changed over time, and about, actually, whilst one death from COVID is of course one death too many, how huge the survival rate figure actually is.
Yeah, thanks, Matt. I mean, the key thing when we first look at this, whenever we update this and we look at the latest snapshot, it's really sensitive to what's happened within that cycle. And it's important to recognize that globally, the rate, the mortality rate is actually lower than this. And right now, this data is being influenced by the fact that we are, for the Northern Hemisphere, in the winter season. Sorry, the late autumn going into the winter season. And around this time, we see a spike in mortality anyway. And we knew right from the start, we were discussing this back in March, April, when we were first becoming really aware of the onset of COVID and what we might call the first wave, that come the autumn, winter, we were going to see an increase in these kind of figures. So 2.5% seems relatively low. Globally, it's actually lower than that. And the survival rate, which is a different way to look at it, approximately is 99 to 99.5%. However, within this, let's take our attention away from the mortality. As Mel quite rightly said, one death from it is a death too many. But let's just take our attention away from that for a moment, because the people that we're going to engage with and that we're going to work with are the survivors, who en masse are the vast majority. And they break down into different groups. So what we see here of these cases of just over 15 million, and then if we look to the right there, we've got 14.7 million people who we can quantifiably account for and say that they've had COVID, either because of a positive test, because of self-reported symptoms, or because of a period of time spent in hospital. So we've got different groups. We've got those who are hospitalized. They're our most severe group. They're the ones who are going to need the most intense amount of recovery, support with their recovery and rehabilitation. Then we have those who weren't hospitalized but had quite severe and prolonged symptoms. What we know of COVID-19 as a virus is there's a direct correlation between the length of time that someone has symptoms and typically the length of time it's shown that they recover from it. And those with the longest symptoms are more likely to become those that we call long haulers or have long COVID. There's an interesting group that are amongst this lot as well, and these actually are difficult to account for and may not play a part in the numbers we see here. And these are the asymptomatic. We know that a huge group of people who will have the COVID-19 virus will be completely asymptomatic. So they'll have it, but show none of the typical things. However, what we're starting to see at this stage is that in their recovery, with regards to factors of deconditioning and post-viral fatigue, they're starting to exhibit the same kind of issues as those who've had symptoms that they can quantifiably describe to somebody. So this is a really mixed population. Some people within there are going to have COVID-19, they're going to be symptomatic for a few days and actually just be able to go pick things back up quite easily. But what we're starting to recognise is that there is an ever-growing population of people who that simply isn't true for, and that a lot of people, to some extent, are going to want, more importantly, need support with their rehabilitation, their restoration in the wake of having had COVID-19. Whatever these figures are right now, they are going to increase. Every time Mel and I get together to present this kind of information to groups or to discuss it, these numbers increase. They are going to increase. Despite the vaccine, these numbers are going to increase. So every time we look at this, it's becoming more and more of an issue for us to get involved with. We're going to discuss this in a moment, I'm sure, knowing what we're going to discuss, but it's important to recognise, by looking at these figures, what part we play in this. These are people within our communities, within our society, that are going to need and massively benefit from support with their physical rehabilitation and restoration.
And just to touch on something you just said there, Col, as well, since these figures on screen are up to date as of today, the last time these figures were put into this this slide in preparation of today was just a few days ago. Since then, total cases have gone up by 1 mil just in a matter of a few days, just to give you guys a sense of rate. And there was even some shifts in the table in terms of countries going up or down a position. UK, for example, was third a few days ago. Now it's in second. And as of about an hour ago, we've got the forewarning that London, for example, here is about to go into a higher tier risk. So, as Col says, it's ever evolving.
And also, Mel, you know, we've heard in the news over the weekend with Germany. Germany's going to announce on Wednesday that it's going to go into another phase of lockdown because of increased numbers. So by no means are we through the storm yet. No means are we through the storm yet. More and more people, these numbers are going to grow for the foreseeable, certainly for the next 4 months.
There's a bit of a visual representation of what we just talked about. No doubt what you see on screen at the moment is familiar to everybody watching this, but it just provides a bit of a visual representation of how the spread is evolving over the continent, of course. We can also map this against this visual, which, if you've not seen it before, the details of the link of how to access it are just under the image there. This is a graphic that's produced by EuropeActive that denotes what the club closure levels are like across Europe. And if we place both of those images next to each other, you can see, of course, how one is influencing the other. Now, we'll use just quickly a bit of a case example of how you locally can look at these sorts of heat maps to help you to understand how individuals in your communities might be affected by COVID. Forgive me, because we're going to use the UK just as a case study, not for bias, but just because it's really easy to explain. But we've got a little bit of a GIF here that when I click the screen in a minute, you will see how the UK starts to change colour effectively over time. So the first visual starts of 30th September, and then this runs until Friday of last week. So as you'll see, there are darker blues present, purple becomes more prevalent. Very shortly, the bands of purple not only go from the west to the east side of the country and in more sporadic areas of the country, showing that the spread of the virus isn't necessarily from one part of a country to the very adjacent next part of the country. It's becoming more disjointed across the whole of the UK. What you also see with this graphic is how lockdowns, circuit breakers, and other government initiatives affect the colour tones of the map. So towards the early part of November, around this time now on the screen, when there's heavy dark blues, the most prevalent amount of purple, the UK was put into a circuit breaker lockdown for a month. You then see that those blues become a lighter shade of blue, the purple starts to disappear a little. But then since we as a country here have come out of that circuit breaker lockdown, the dark blues are coming back, the purples are coming back. The very last visual in this reel that you can see, where the country's predominantly a yellow-green, that's a visual of the country back in March, when we all started to face initial lockdowns. So you can see, as Carl said, so far as how we've evolved since March, in terms of the statistics, back then we were, relatively speaking, quite unaffected by the volume of people in the UK that had contracted the virus, have been affected by the virus. Now, wherever there has been a dark green, a blue or a purple, somebody is dealing with COVID-19 or long COVID. So what we've done with UK coaches and trainers and club operators here is identify where those areas of the country are that are the higher case areas, to work with coaches and trainers and clubs there to help as many people as possible who've been affected in those areas first. And then in other areas of the country that are less affected right now, those coaches, trainers and clubs are trying to understand how that they can prepare to help individuals in their local area if and in the event of a flare-up. And of course, this system that we've adopted can be applied across any country across Europe. You guys will have access to your own equivalent heat maps, where you can see over time where the areas are that have been most affected. That said, just because a part of the country may not have a really high case count, there are still going to be instances where there's a high number of individuals local to you that need help. For example, one of our course graduates, he lives in quite a low risk, low tier part of the UK, but yet within a week of certifying, received 25 individuals from his local health practitioner who needed help. So he didn't necessarily expect it, but once he started communicating with the local community, it was knocks on the door and the phone was ringing. So that just gives you some idea, though, how to gauge what you might experience local to you. When it comes to identifying and starting conversations off with individuals who've been affected by COVID, we wanted to share with you guys what you might expect. This is a short video where 3 individuals share their account of COVID-19, all quite similar, all quite common, indeed not the worst instances, but it will give you a very general idea of some of the conversations that you may start to have. So I'll play this for you guys now.
It's called a novel virus, which means it's new to all of us.
Hi, my name is Charlie Peters. I'm 30 years old and I'm currently living in northwest London. I'm a professional Muay Thai fighter with over 13 years experience, and I'm currently transitioning over into endurance training. I'm working my way to a half Ironman later this year. I've had 67 professional Muay Thai fights, former 3-time world champion and the current UK #1. So I work at various gyms around London, taking group fitness, as well as personally training individuals to teach them boxing or Muay Thai. I cycle quite a lot around London and I'm always on my feet, walking anywhere and everywhere that I can. So I'm very, very active. So I got COVID.
I was having my 60th birthday on the 3rd of April. And so from the beginning of January up until then, I was on a mission and I was absolutely determined I wasn't going to hit 60 feeling less than my best self. So, you know, swinging 16K kettlebells and running around and doing all sorts and bouncing about, feeling as fit as a fit thing. I got back down to my fighting weight. I went to the supermarket at 7 a.m. and I think I got it there.
Hi, I'm Kate. I'm 38 from Warwickshire. I contracted COVID around mid-March. I'm now 19 weeks post-COVID.
So one thing I remember clearly from COVID is feeling how fatigued I was. I literally didn't do anything all day, but I just felt exhausted.
And it's knowing what fatigue is. It's different to tiredness. I felt absolutely fatigued, absolutely completely wiped out. Breathless going upstairs, total fatigue, absolutely wiped me out.
My initial symptoms were very flu-like and lasted only around a week. But the hardest part of it was the 3 weeks after that. And I really did feel super fatigued, really struggled actually to go about my daily business. And that was quite difficult. I'm an at-home mum of 2. There was a moment where I was quite afraid. The effort on my lungs was quite intense.
But I noticed my heart rate just shoot up. And even if I tried to run really slowly, my heart rate would stay high. I've done a lot of sprint work. Heart rate is a clear indication of how much stress the body's taking. That's when I knew something was quite serious. I was more so frustrated mentally. I'm so fortunate that, I've been okay.
My heart doesn't skip a beat normally, but I could feel my heart thudding in my chest, and I felt fatigued for 2 or 3 days afterwards. My neck I could feel my pulse in my neck. My head felt it was going to explode. After that took me really downhill.
Maybe I trained 4 times, maybe 5 times a week before. I do a lot of resistance work, mainly circuit-based. If I do any cardio, it is mainly on the biking side. Initially, just getting back on the biking side was really, really difficult, and I couldn't maintain long sessions.
So clearly I'm not unusual. There's quite a lot of people who are going down that road. All consuming, and just to walk downstairs and get a cup of tea was exhausting. And by the way, during the night, I've had this really, really weird pain in my head, and my cheek feels numb. And she just said, you've got to get an ambulance and get yourself to hospital quick, because you might be having a stroke or have had a stroke. They've said I've got some mild neurological nerve damage. If you go to a class and says, right, well, we're going to do an EMOM, every minute on the minute. I don't think my brain could actually process that as well. At the moment, I'm really scared to start again, because I don't know whether it's going to trigger it off all over again. But I don't want to not start again, because I want to get back to myself. But I don't know when the right time will be to start.
It's not really how much you do. I think it's probably short and steady wins the race with this kind of thing.
So that can be as simple as a 5-minute walk on a treadmill, and at a given pace, at a given kind of incline, and it's just see how the body responds, and almost
try and figure out what kind of resources we'd need, what kind of testing we'd need, what kind of staff we'd need.
So at least I'd say about 8 to 10 weeks since I've been feeling better. You get to learn your body in a different way, in a different manner. My body's never been through something like that. I've never been through it mentally and physically. So I feel like I've learned a lot more about myself. I've been extremely lucky. I've been extremely, extremely lucky. What you learn about yourself going through a battle like that is an amazing thing to happen. But I've been very fortunate and very lucky in comparison to many other people. So my thoughts are with them, definitely.
Because it never stops. It nenever bottomed out. Without a vaccine, we are looking at a very different world for the next 2 or 3 years.
We need a new normal for everything, don't we?
So special thanks to Charlie, Jan and Kate for sharing their account of COVID-19 with us, and also to Dr. Mick Malloy, who is a disaster medical specialist, and Lee Halftek, who is an elite level rehabilitation coach, two of the experts that we work with. It's worth pointing out that the guys filmed those interviews with us back in June time. And sadly, all three of them are still now dealing with, very much improved, but are still dealing with the repercussions of COVID-19. What we shared there, as I mentioned before, is quite a common scenario in terms of symptoms, but the spectrum can actually be quite dramatic. So Cole's going to talk now about some of the more brutal expressions of COVID-19.
Yeah, this is really data from Professor Vo over in the States, but is reasonably accurate to what we're seeing across the world, really, certainly within Europe and Western industrialized nations. Again, if we stop and we consider for a moment, you know, those mortalities, well, what about those other people? Because lots of people are going to hospital, but thankfully not everybody's dying. So here we are in black and white, some straightforward figures for us to consider. This is the reality of COVID-19. So for every one person who dies, 19 will require hospitalization on average. 18 of those will have permanent heart damage for the rest of their lives. And anyone, I'm sure a lot of people listening here will have some understanding now of how this virus operates and what it does. Originally, it was identified as attacking the respiratory system, attaching itself to the lung. Quite quickly after that, we recognized that it can go straight to cardiac tissue. It can actually affect directly the hemoglobin in the blood. So none of this really, given how the virus functions, is that surprising. But these are the debilitating consequences of somebody who doesn't die, but has had the course of their health status changed permanently. 10 more will have permanent lung damage. 3 will have a stroke. 2 will have neurological damage that leads to chronic weakness and a lack of coordination. And 2 will have neurological damage that leads to a loss of cognitive function. So right across the board there, we can see quite brutal statistics with regards to those who are hospitalized and are now in a position whereby they have to pick themselves back up and start to come to terms with life on new terms. There is going to be an acute phase of rehabilitation for these people, and that's not our job as the fitness industry. That's not where we intervene. But across Europe, certainly in the UK, and it's similar in the States and parts of Australia, what we see is that once a person goes beyond that acute phase, they're really left unto their own devices. And the long-term health and wellness and physical independence of that individual, of those individuals, which are going to amount to hundreds of thousands, if not more, is then down to what they can access within their local community, within society. And there is no industry, the health industry hinges off the fitness industry. We have the infrastructure to support this as we move forward. All of these people are the more severe examples. They will get past acute rehabilitation and require longer term support and guidance with regards to their physical activity, exercise prescription, and some lifestyle choices. Outside of this group, if we go back a few slides, are that much bigger group who were not hospitalized but had severe enough symptoms for it to influence how they conduct themselves. They might have been bed rested in isolation for whatever period. And like that video you've just seen, those people are typical of that it can take months and months of rehabilitation, restoration, before they start to move back to what they previously considered to be normal. And in reality, for all of these people, for these people who are captured within this data set, arguably the more severe, the most brutal statistics, but even for those others, we need to start to look towards new goals, new physical fitness ambitions to move those people forward so that COVID-19 effectively becomes something that's part of their past.
As Cole said there, when we look at the masses who are lacking any kind of support, who are seeking all sorts of different guidance, who are trying to push past the virus before necessary restoration and recovery has occurred, when we look at their situation, this is what we've found. So some of the captions and the posts that you'll see on this slide and the next slide are from individuals who are coping with COVID-19 independently in isolation. And as you'll see from the messages on, I'll just give you guys a few minutes to kind of scan through those, but as you'll see from these messages and the messages on the next slide, if they've, as Col says, if they've had no intervention through hospital or local healthcare, what they're trying to do is self-prescribe themselves out of their own situation. And because they're trying to push too soon, with every 2 steps they think they're taking forward, they're taking 5 steps back and worsening their condition, which is prolonging the effects of long COVID. As Colin and I talk about from an analogy perspective, it's akin to breaking your leg and then going for a run and then keep on going for runs. You guys obviously understand the fundamentals of recovery and restoration, specifically as far as a virus is concerned. But these guys are desperate. They're desperate to continue on with their daily life, being parents, worried about losing their jobs, worried about the impact it's having on their relationships. So all that's happening at the moment is these individuals are speaking to each other, and they're leaning on each other to share in some wins that one individual may have had, or some supplement that another individual has had. And that's the only advice that they're taking from Google or from social media. But as Col says, the actual real sort of filtered and accurate and valid advice that they could take is from their local fitness professional, via their local gym, or directly with one of you guys. So these messages that you see on screen, these are within groups that Col and I are part of, and we've had conversations with some of these individuals. And as you can imagine, the more and more of the conversations that we have had of this nature, the more insight we are having into how badly the virus is affecting individuals in some circumstances. And without wishing to be morbid or sensational, there are individuals, as you can see, that are out there losing hope. They think that they're going to be like this forever. They're worried that they're just being, you know, a bit pathetic, and they ought to just be getting on with things. So we've become, Col and I have become, the word passionate is overused, but we've become quite passionate about stepping in directly with these individuals and connecting them with as many coaches across the world as we can. And of course you can't see because we've blanked out the individuals' names, but these comments are from people from every corner of the globe, and there's tens of thousands of them. So we want to help as many of these people as possible, and we can't do it unless we all work together.
Just on that, Mel, it's worth pointing out that COVID-19 is a novel virus, and the temptation is always to say, well, how is it similar to other viruses that we know about? And there's good reason for doing that, because we can track it and we can start to predict and know what to expect. But at the same time, it is a novel virus, and people are aware of that. So once they've had it or have it, there is this massive idea of the unknown, and that's why people start to lose hope, and that's why people start to panic, and that's why they'll reach out anywhere to get some kind of input and advice. And more often than not, there's no filter on that information, and what people are given back is based on second, third hand information that they may have taken from somewhere across social media, from a more unreliable source. So a big part of what Mel and I are working on, it's been a big part of our campaign from the start, is to equip people like you with reliable, research-informed information so that you can put them right. Not only to support their rehabilitation effectively, but also to clarify these issues, to give them a sense of confidence, and also for them to gain an appreciation of how long it's likely to take, and therefore to invest in the process and not constantly be worrying about what's not happening.
I put my screen on there, guys, just because I was just interested, because that phrase novel virus sort of gets me thinking. And as a novel virus, how then do you come up with exercise guidelines for an unknown?
Yeah,
is that a fair question?
That's a really good question, and that crops up a lot, Julian. And what we do know. So first of all, if we're having this, if I was to try and attempt to answer that back in April, there'd be so much more that we didn't know. Right now, we know a lot more about the way this virus functions, and hence why we know how the vaccine works, because we know how the virus functions. However, way before all that, what we knew is that in the wake of the virus, so when someone was no longer active with the virus, but now dealing with the after effects, the commonality with the things that we see with regards to cardiac rehabilitation, the effect that it has on the tissue, for pulmonary, any kind of neurological, something that affects the blood, those things we know really well. We've been rehabilitating people from cardiac disease and cardiac events, COPD, stroke, multiple factors. We've been doing that for decades and doing it really, really. So it was really about being able to bring that key information together to equip people to say, right, the virus has been active. The virus is no longer active. And this is the damage or the trauma that's been left. And these are the key areas. So what we need to do is get in and start to bring about an index of priority as to what we need to focus on with regards to restoration, rehabilitation, and those kind of practices. Hence why much of our recommended monitoring starts with things that we typically see within clinical environments to create that overlap. So to restore, rehabilitate, and then start to program effectively moving forward. So it's looking at all those common things. Now, fortunately, where we're at now as we're heading towards the end of the year, we have far greater understanding with regards to how COVID-19 functions as a virus. Don't get me wrong, it's still a bit rogue. Predicting how it will affect an individual is nigh on impossible. You have to wait until they are symptomatic or until the virus has passed and you can see what kind of trauma has been brought about. But there is still a commonality. There's still a big area that you can go, right, it's going to fit within this model for the vast majority of people. And then you can start to pick it up from there. So, yeah.
So, given that understanding and, it impacts on all of those body systems, CV, pulmonary, etc. So is there a particular type of exercise that might be more generically applied, that is the best type of exercise, I guess, is what I'm asking?
Absolutely, yeah, absolutely. Best practice is to start with cardiorespiratory. So we want to increase a person's exercise tolerance. We want to get that aerobic system built back up from the ground. And it literally is that, Julian. We've got to look at going back to how we used to function as an industry 15, 20 years ago with some really good, inventive, creative, engaging physical activity prescription. So don't just tell someone to go for a walk. How can we build on that and make it more meaningful? But we need to start from there, start to develop that exercise capacity, that aerobic tolerance. And then once we start to get that into a reasonable, and what do we mean by a reasonable range? Well, anything that really, taking all you guys now back to Physiology 101, anything that gets us past those initial stages of oxygen deficit, so that we know metabolically and physiologically the body's starting to respond, show some level of adaptation and response. Once we can consolidate that, and that could take us 2 to 3 months of building that up from the ground, then we can start to look at muscular factors and neurological factors so that we can start to build a person towards more physical independence and then build on that new foundation of exercise tolerance and aerobic capacity. Anyone who's watching this, if you were ever guilty in the past of using the phrase pointless cardio, never use it again. Because what COVID-19 has taught everyone is that cardio, as we are, a species that relies on oxygen, is vital. It really is vital. Our aerobic capacity, our tolerance is fundamental to our health, wellness, and fitness. And so right now, that's what we start from. We strip it right back to that component. We build that foundation, and then we start to elaborate out.
Okay, sorry. And last question. I'm into it now, Carl. But I know I saw on your write-up, or I was reading something on the web, and it was, you've done some work, I think, with exercise and the management of low back pain, that kind of area, and me too. And the big thing that they talk about there is, I think they call it activity cycling or something like that. But basically, somebody says, well, look, I've got to do something about this. They want to take a positive approach to it, so they go out and they go, they go at it a little bit too hard, and then they get pain, and then they're back into that cycle, and then they rest and they try. So I guess in terms of it's about the the dose of exercise that you actually prescribe and getting that appropriate, I guess.
Absolutely, and if you only take one thing from this talk today, please take this. If you recommend exercise for anyone who's had COVID-19, start by recommending something you know is beneath what they're capable of. We need to start to, one, psychologically get people started from a success-driven point of view, but more importantly, physiologically, we've just got to gradually, when it comes to fatigue, and I promise you, I've been researching fatigue now for over a quarter of a century, so bear with me. You have to work with it and not against it. Bit like, very similar to back pain. I've worked a lot in back pain. I've done a lot of research in back pain. You have to work with it, not against it. It's not like just acute tiredness or the kind of tiredness we invoke with exercise training. Fatigue is a set of complex circumstances within the body. And what we have to do is work with it. And we have to repeatedly underscore it, but just look to increase that ceiling level little by little every single day. It's a war of attrition. It's the art of patience. And we've got to be that person for the person who's having to undergo it. We've got to be the pace limiting step. We've got to give them the assurance. Yes, this might not feel demanding. This might not feel like those ideas we have about exercise and working really hard and destroying ourselves. It's not that. We have to go very gradually with this, and we want to just gradually build up and be consistent. We don't want boom and bust. Boom and bust in this instance is to send someone even further back. So we've got to be patient. We've got to take it on. And believe me, that's the exact same best route for anyone who's had back pain of any of its forms. And certainly with post-viral fatigue, this is the way to win that situation. Very, very gradually, just gradually increasing the load and the demand and monitoring it. If you're not assessing, you're guessing. So we need to be measuring that, making sure we're capturing useful and reliable data that gives us an insight to how that individual is progressing, so that we can meet certain gateways and then push on through to the next phase.
Last question, and then we can get back to the presentation. But I'm aware that I'm just thinking about all those personal trainers out there and fitness instructors all out in our communities doing what they do, or obviously that's been somewhat interrupted. But I'm aware that certainly that there's been a certain amount of money committed to the development of quite specialist rehab centers, etc. And so then you think highly qualified people, very high level kind of input. So I'm thinking, how does our workforce of personal trainers and fitness instructors and group fitness instructors, what role do they have to play in this? If we've got specialist rehab centers, do they have a role to play in this? How does that work?
Do you want my honest?
I do want your honest opinion, please, Scott. Yes.
Yeah, the people matter far more than the rehab centres. My honest answer to that, Julian, is what a poor way to invest. In reality, the infrastructure is already there. The PTs, anyone who's watching this live now or watches it later, you're the people who are going to get this over the line. It's your skill set. It's your interaction. It's your ability to foster relationships, gain trust, win confidence, and keep a person motivated when their own motivation runs out. It's not a building that can do that. We've been building buildings for decades, and the statistics haven't changed. In fact, they've got worse. Obesity, type 2 diabetes, cardiovascular disease, lifestyle preventable cancers, metabolic syndrome, stroke. Let's pile them all up. They've got worse and worse and worse. That whole time, over the past 4 decades, more and more fitness centres, buildings, gyms, centres. Buildings are not the key to this. And also, there's a geographical limitation to that. What we need are people within communities who have a name and an identity where those people can just access them with no barriers and no need to go onto another waiting list to be filtered based on some kind of notion of stratification of risk or stratification of need. A person needs to be able to walk into their local gym, local studio, pick up a call and say, can I come and can I speak to someone tomorrow? And start that journey. You know, once again, the opportunity to do it right, in my opinion, has been missed, because the way to do this right would have been to say, right, we're going to pool together this funding, and we're going to make sure that these coaches, these PTs, these coaches are paid for their time and expertise to service these people in their community. That's how.
No, I would totally agree with that. You know, it's all about community and being in communities in order to affect those communities. And I you know, I think that the workforce that we can provide through personal trainers is well positioned for that. I guess there is an aspect though of upskilling involved in that, Cole, and greater understanding of what this pathology is and how we deal with it. But I guess that's why guys like you are here to help us with that. That's
right. Yeah, there is an upskilling required, and for a lot of people, for a lot of PTs, it's going to be a bit of a case of going back to 101 and remembering that best practice stuff that was learned the first time you did a PT qualification, but also just extending on that, being aware of the contraindications, some of the complexities around working with this type of demographic and population, and then taking all that stuff we're really good at and embedding it within this context. That's a huge part of it, is looking at, well, what's my skill set and how does it fit here? And hopefully that's what we're doing for people, is we're giving them, one, the confidence to apply their skill set within that specific context, and two, extending on it, just giving them more ideas and a way to do things a little bit better, refinement. You know, in the kind of professions that we're in, we're constantly looking to improve. You know, continuing education, our own professional development, it never ends. We're constantly looking forward, whether it's that next journal article you've read, book chapter, seminar you've attended, something like this. We're constantly investing in ourselves to go forward. And that's what this is. It's putting it all together so that we can focus that and apply it to this population.
Yeah, absolutely. And I think I know that our professionals out there have a great passion and thirst for continuing education and continuing learning, and invest a lot of money and time in doing that. And I'm sure this will be no exception. But I'll step back a little bit and just let you carry on, guys. Mel, I don't know if you want to come in at this point.
Well, thanks, Julian. They were very enjoyable and on-point questions. So thank you for taking us down that path, and actually unintentionally seamlessly links us back in with this slide, because you talked there about, just like that, you talked there about the rehab centres, but one of the things that Colin and I talk about is top left on this screen as I'm looking at it, and the clients and members that we already serve. We're going to have clients and members that have COVID and long COVID. And we would much prefer for us to work with them rather than for them to have to go to another facility to get care. If they want to get treatment and rehabilitation in a place they feel safe, they're part of the community, they already have a relationship with their coach, why should we make them feel like a patient? So there's a big role that we can already play with the audiences that we're hands-on with. Attached to that other side, we got newcomers. So there's going to be a shed ton of people across every single community globally that doesn't have a coach, doesn't have a relationship with a gym, but also doesn't want to necessarily feel like a patient, that needs some help. So there's a message that we can spread as a professional, as a facility, that we're available, we're embedded in our communities, and we're ready to receive people. We've also found that a lot of new types of referrals are coming through. So individuals who know a coach who can help a person with COVID, but who may not have had COVID themselves, typically has friends or family that are wondering what they can do. So there's a lot of referrals via family, friends, and clients already happening. We talked before as well about local healthcare practitioners, primary care groups, rehab groups, physios, and so on, who once a patient is released from their care and that acute phase, as Cole says at the moment, goes out into limbo. But the GPs want to be able to signpost those individuals onto a next stage of care. So that's a new type of conversation that some of our coaches are having with their local general practitioners to let them know that they're certified and they're ready to receive people. And the health practitioners are very receptive to that because they want to provide a pathway for people. Corporate rehab, bottom left. As a sector, we've been conducting corporate outreach since the dawn of time, but this is a slightly different style of conversation, again, with local employers to us. They've had employees out on sick in some cases since March. Individuals are extremely terrified about losing their jobs. It's costing employers fortune. Those that are coming back to work, and often too soon, can't concentrate at work, can't focus on emails, struggle at meetings, can't commute to work. So there's a bigger interest now than ever before from corporate employers to engage with the professional who can come in and get hands-on with their staff. And then the bottom of the screen, we didn't expect this, but we've received communications from schools who've had students or university students that have been affected by COVID and don't know what to do, but want to provide a solution to help their kids. So more than ever, these relationships, they're not new relationships to us as a sector or as a profession, but the receptivity of everyone across the community, the need across the community is so different now. The response that we can receive if we get out there and spread the word of our role in this picture and our role as the gym as well is so different now. And whilst on screen it seems easier said than done, our grad coaches who are already out there doing this are picking up 3, 5, 15, 20 individuals at a time to be received into their care.
And therein lies the opportunity, isn't it? You know, that whether that's a conversation about somebody recovering from COVID or a wider conversation about health, I think there's a bigger and more receptive audience out there all of a sudden, unsurprisingly.
Yeah, absolutely. In fact, this morning we were in a big meeting with a European club group who'd said the same thing. In a bizarre way, it's the word fortunate is completely wrong, but it's an opportunity to have a conversation about COVID, but widen it to cancer and diabetes and everything else.
Yeah, and I guess, I mean, Colin, I know you've been in the industry a long time, and that for me is, yes, this has been nightmarish period, but at the same time, as Mel says, that there is an opportunity here, and that shift of our potential shift of our industry, maybe a little bit more away from the aesthetic to the more health focus, is a hugely positive thing, right?
Absolutely. I've been campaigning for this for over 20 years. You know, how you look is 3rd, 4th place to how you feel and how you function. Health is everything. And too many people are part of the general populations were mistakenly, don't really know why, given this notion that they should try and replicate the training that elite athletes do. Elite athletes make up less than 0.1% of the entire global population. That's just entertainment. That's just something we all tune in and watch. The rest of us should be engaging in physical activity, exercise, and nutrition choices that optimize our health. And I agree, what's come off the back of COVID-19, because we've discussed things like comorbidities, risk, you know, we've got back to a sensible discussion around overweight and obesity and the risk that is. You know, we can talk about these things now without being accused of, you know, of targeting people. This is really important. I welcome this. And what else I've welcomed is seeing across social media platforms and you know, television debates and everywhere else that these things take place, are people starting to discuss things like vitamin D, discuss things like the importance of 30 minutes a day of physical activity and exercise, and starting to recognize that this can work on their own terms, but also like preventative is far better than corrective, and that you can minimize your risk, maybe not of contracting COVID-19, but of the worst potential symptoms. So people now, I'd say, are more receptive to the right message. Now is the key time for every single PT and coach to get the right message across and to tell people that we are there for them, that it's their goal that we align them to, and not some notion we have of what we want to turn them into. Now, I'd say most of the fitness industry has functioned that way anyway. Most people who want to be a PT or a coach are motivated by the desire to help people achieve their goals. And the tiniest percent who are the online gurus and make the front of a magazine have convinced the rest of our society that we want to turn everybody into something abnormal and some kind of fitness freak. And that's never been the truth. So right now there is a banner for us to claim that ground back, because it is all about health and physically being able to take more joy from the world. And that's what we're about.
Fantastic. Mel, so where are we? I think we're getting close to the end of our hour. We could probably go on, but please, you carry on.
Okay. Julian, you mentioned before about upskilling in the context of COVID-19 and how easy it is to catch up on what COVID-19 is and how you can then support an individual. So where our relationship very first began, Julian, I guess, is when we came to you to say, we've designed a course that teaches trainers and coaches exactly how to do that. So just to, we won't go into too much detail on the course for now, but just to address a couple of the sort of frequently asked questions that coaches and trainers ask us relative to the course. The course is delivered online. There are 61 videos in the course. Handful of them last less than a minute in length. There are a good handful that are up to an hour, but on average, the videos are around 23 minutes long, designed so that busy coaches, trainers can learn them on the go, in the bath, in the gym. Altogether, there's a little under 20 hours worth of videos in there. So whilst we'll talk about this a little later, just because it's more relevant while we're in the matter of the course, on average, most individuals who go through the course will get through the content in about 30 to 45 days around jobs, kids. But we do have individuals that power through within 14 days. So obviously depends on people's commitments and so on. Every single month, there's a live Q&A with Carl and our often cameo guest appearances as well, where anybody going through the content or even after graduation can dial in monthly and pose questions about content, individual case study scenarios. There's an assessment at the end, which is an online assessment. When the guys pass that, then they'll be considered a Rebuild certified coach, which then gives them the certification to move forward and work with individuals confidently and competently.
Fantastic.
Hang on, trigger happy finger. We've talked a lot about the general themes in this slide, and conscious of everybody's time, and thank you to those that I can see have stayed on. This is a summary slide really that explains how once you've gone through the content to build it into the systems and the delivery that coaches and trainers are already using. So we've talked loads about the community role that we can play in helping people, whether we work with them already or not. We've also talked a lot about leading by example. So this is a big nod towards our position as health leaders in the community, retaining the relationships that we've already got. As we said before, if someone's got COVID, that we work with them rather than signpost them off to another individual. And we've also talked again a few times about being a resource for newcomers, referrals and so on. How then a coach or a trainer or a club decides to deliver the service is entirely up to the individual professional. So in any way that you would deliver one-to-one personal training with general population or prenatal female, etc. It's exactly the same environment. So how it's priced, how it's delivered is at an individual's discretion. As Cole said before, whether that's the exercise prescription is a 60-minute session in the gym or it's a 30-minute walk outdoors, the principle remains the same. We also see this, though, as if somebody's not already engaged in a one-to-one relationship with a coach, this is likely to lead to a longer-term one-to-one relationship with a coach. Once somebody's come through this initial recovery phase, the relationship that will have been developed over that period will be profound, and they're likely to want to understand what's next. So where we say their gateway to PT, that's what we refer to. It's also important to point out, though, that we built the course with club closures in mind, lockdowns in mind. We were in a lockdown when we built the course, so we expected future restrictions. So the course is delivered so that if as a professional you're working with someone who is still at home, either by choice or because they have to be, or you need to work with someone remotely because the facility that you would normally use is closed, there are systems in the course. Well, the course describes systems that allow you to adopt your practice to accommodate those people. And we also recognise that there's coaches and trainers out there who only work with people digitally and online in some instances. What's powerful about that as well is that as we grow the team of coaches and trainers who have gone through the certification, there may be people in the Netherlands that need support, and we may not have enough coaches in the Netherlands to support those people. So if we can connect certain trainers in France with individuals in Netherlands that need help, we just want to provide as much access and comms between those that need help and coaches as possible without some of perhaps the obvious barriers that we've had in the past. So, anything I missed there, Carl?
No, that was everything.
This is just a bit of a snapshot, really, of an email that came through to myself from one of our graduate coaches from an individual who's been suffering with COVID-19 since March. He started working with her in November, and within the first 7 to 10 days, we received this note of thanks from her to him. And as you'll see, as she puts it, he saved her. And it was as simple as a few initial phone conversations and a very first one-to-one. And that was as profound an impact as he made so quickly, really.
Fantastic.
So for anybody watching, trigger happy finger, anybody watching who wants to know more and wants to get involved and to upskill through the course, we've put a few next steps on screen here. So the course that we've been referring to, of course, is Rebuild. It's available online now. It's currently available in English. As we've said already, we built it so it can be delivered by coaches in the gym, outdoors, at home, wherever you're currently operating. EREPS members receive 25% off their CAWS club and coach memberships using the code on screen until Jan 31. A contribution from every monthly membership is reserved to fund projects for vulnerable groups and rebuilding the fitness industry. That was a big part of what we wanted to do from the outset and is part of our notion about being bigger than an education company. We already talked a little bit about how long typically it takes an individual to go through the course. Realistically, it's going to take probably, dependent on where you feel you're at already in terms of understanding a lot of the concepts and principles in the course, it might take 30 to 90 days before you feel super hyper confident about working with an individual. But certainly as early as around 10 days of going through the content, when you've got your head around the fundamental impacts of COVID-19 on a person, you would feel comfortable for sure in having conversations with members of your immediate community, reaching out beyond the immediate community and linking up with local healthcare providers within that 10-day period, and being comfortable that you knew what you were talking about, to let them know that within X period of time you would be ready to receive people that need help. When an individual graduates from the course, we'll list them on our CAWS registry of graduates, unless they advise us that they would prefer us not to. That means that when we receive the incoming inquiries that we receive here too, that we will always aim to connect an individual who needs help with their most local coach. So because we have that registry, we can signpost people direct to individuals as well. And Colin, Julian, you talked before about this COVID theme being, for want of a better description, a door opener to discussing other health conditions with other individuals and with healthcare practitioners. So a lot of the people that complete the Rebuild course go on to complete Fortitude, which focuses on some of those conditions, which is included in the same membership. I should point out that although it is a membership, it's designed so that you guys can cancel the membership anytime. So you could sign up for a month, complete the Rebuild course, and then cancel the membership and then rejoin us again in 6 months' time if you choose to. So just for info, really, the coach monthly membership with the EREPS discount takes it down to €27.71 a month. And so from as little as that, you guys could get started. Anything I've missed there in terms of the smaller detail? Julie?
No, it's great, and thank you for offering the guys, the EREPS members, a discount, Mel. Very much appreciated.
No, absolutely. Opening the floor then, before we leave everybody to continue their afternoons. I see there's been no questions come through while we've been talking, but if anybody wants to fire anything through now, they're very welcome. Or if, Julian, there's any questions you would like to ask on behalf of the guys, most likely to Col, no doubt, then we can tackle those now.
Yeah, I mean, I guess just as a concluding one, because we'll have to wrap up. But the guys, please, anybody who wants to ask questions, please forward them to us at EREPS, and we can forward them on to the guys and ask those questions. I mean, I guess I've seen the program myself. I think it's an excellent program. I think it's just what's needed at this particular moment. Of course, I think increasingly we'll see more and more guidance coming out here, and people will need to stay updated with that. I guess, yeah, I'm just really pleased to have you both on board. And I mean, I guess in terms of the guys who are looking at this program, they know your background, Colin. I guess you're working with a lot of other individuals in bringing this all together, right?
That's right, yeah. So there is a number of people who we've been able to bring in to engage with this, either from how they've informed it from a research point of view, and certainly anyone who takes part in any of the programs. You don't just listen to me the whole time. There are experts that we've been able to recruit from around the world, really, that are inputting with their specific content and specific areas, upon this. And as we grow it, we're looking to grow that pool of expert contributors who are putting that information in. So yeah, so that's why, even if you just start now and then you check in again with us in 4, 5, 6 months' time, it's very much a live, organic education suite. And the idea is that as we bring frontline and centre those leading voices from all across the industry, from all around the world.
That's great, and I hope I can help with that, Colin, and maybe put you in touch with a few people that could join in that conversation. I see we've just had one question come in here on, let's just see if we can answer that one, shall we? Yeah. So, COVID aftermath on cognitive from an athlete point of view. Well, okay, from an athlete or from anybody's point of view, the impact on cognitive function.
Yeah, I mean, it's multifaceted. So it can be anything from a diagnosable interference with regard to cognitive function, as to whether or not they can be able to focus on simple task coordination, continued train of thought. People have had issues even with regards to going back to their normal jobs because they simply can't remain cognitively engaged for that long because, again, factors of cognitive fatigue and even decision making. There is a question now, certainly here within the UK, with regards to how this manifests and is reported as to whether or not some people are going to have to redo things like driving tests and even heavy machinery tests where they work in order for them to be passed as competent to go back to what they did before. I think it's important for us to recognise where our expertise ends and what we can work on. We can certainly help and do some structured exercise with regards to neuromuscular facilitation, getting people to coordinate. We can challenge people from a cognitive point of view within the session with simple things, but it's really important to recognise that if it's at a diagnosable stage, then they will be or need to be under the care and supervision of a medical expert who's going to help them in that area. But let's not make any bones about it. We know across the board, study after study, case study after case study, the way to fine-tune cognitive function is through reinforcement of simple behaviour. And that's why exercise rehabilitation plays its part in cognitive restoration and rehabilitation, because we can do that. Even as simple as counting reps, sets, reps, repeating a simple movement, challenging balance and coordination, peripheral sense, proprioception are all ways in which we can support the return of normal cognitive function.
Oh, fantastic. Yeah, all of the questions are flooding in now. Look, so any data on athletic performance going down post-COVID? Well, I could imagine it would have an impact, right?
There is, yeah, and sadly, the fitter you are, the more severe the impact. So there's this old notion, isn't there, that being fit makes you resilient. And actually, as someone who spends a long time working with elite athletes, they're like fine-tuned motors. It actually takes less for them to go wrong. So what we've seen across the board where athletes have had COVID-19 is more debilitating impact and a longer road to recovery. So this is something that's growing as more and more of a concern within those athlete populations. Fortunately for them, they are inherently embedded within a department and a team that's going to look after them. So they're going to have strength and conditioning coaches, they're going to have physiotherapists, sports rehabilitators, nutritionists, medic as and when they need to see one. So those athletes are in the exact prime environment for them to have the most effective recovery. So yeah, it's hitting them hard, but they've got the team around them to manage it. Sure. Whereas the rest of us have got to somehow function that way, be that department for every member of the general population who needs the exact same type of support. And that's why it's down to us to act as the S&C coach, the rehab physio, the sports therapist, and to be able to give them good nutrition choices so that the average person benefits from what the elite athletes are getting. But yeah, it really is taking its toll in some areas.
Yeah, okay, I bet. Okay, guys. Yeah, I could continue chatting. Actually, all very fascinating. Actually, and as I say, I've seen the course myself. I think it's great. Well done to both of you for taking the initiative here. It's much needed. I hope that our EREPS members will engage in the course, and we will continue to involve you both in our work at EuropeActive, I hope.
Brilliant. Thank you, Julian. Thanks very much. Thanks for having us this afternoon.
Yeah, no problem.
Thanks,
Great stuff, guys.